For today's webinar, we are very pleased to be joined by Karl Cooper, Director of Public Health Programs at the American Association on Health and Disability. Karl will cover disability etiquette and basic accessibility considerations for anyone doing enrollment work, and he will provide an overview of questions a person with a disability needs to think about when considering their healthcare options in the marketplace. With that, I'll turn it over to Karl to get us started.
Thank you, and good afternoon or good morning, depending on where you are. As Ina mentioned, my name is Karl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability. For those of you who are not familiar with our organization, we are a national cross-disability organization located in Rockville, Maryland, which is just outside Washington, D.C. Our mission statement is to promote health and wellness for people with disabilities. So we are cross-disability, meaning all types of disability, mobility, intellectual, mental health, and sensory disabilities. And we are also across the lifespan, so not focusing on children or older adults, but from all the way from birth till the end of life. We do this through 5 main objectives. We work to reduce health disparities. We advocate for community inclusion. We promote full accessibility. We work to integrate disability into the public health agenda, and we work to advance knowledge translation and disability research. So before we go any further, it's always important to know exactly what you're talking about when you're talking about the disability community. So I like to do a short overview of who the disability population is, so you know your audience and who you're doing outreach to when you're working with this population. So let's take a look at some health disparities that are unique to people with disabilities. Now, a common question I will get when it comes to people with disabilities is understanding who exactly we mean when we're talking about this population. Since I am an attorney by training, I get a common question, well, how are you defining a disability? You know, what does the law say is a person with a disability? And the answer to this question is complicated because there are several types of definitions that are used in various programs that are either very restrictive or very broad. So if you go to the most restrictive definition of disability, you're talking about people that qualify for Social Security disability benefits, which is obviously a program that you want to be a little more limited in, not just anybody to be able to have access to. So that's a very small percentage of the population. You take that to the broadest definition of disability, and then you're talking about people who are disabilities as defined by the Americans with Disabilities Act. And that's obviously an act designed to limit and eliminate discrimination against people with disabilities. So as a result, you want that definition to be very broad. And many times if you hear the statistic 1 in 4 or 1 in 5 people have a disability, it's that definition that is generally being used for those purposes. For the purposes of the statistics I'm going to be providing for the next couple of minutes, we're talking about a group of people with disabilities that are somewhere in between those two extremes. And according to HHS, they define it as someone that has a disability which seriously limits them. And this makes up about 12.5% of the population, which is 1 in 8 individuals. So these people with a disability are over twice as likely not to see a doctor due to cost, which obviously becomes very important if you're talking about health insurance and trying to find plans that people can afford. They're over 30% more likely to be obese. They are 60% more likely to smoke, and they are over 2.5 times more likely to develop diabetes. So already you can see that there are a number of health outcomes and factors that are already not in the favor of this population. Some more disparities. Well, women with disabilities are less likely to have a current mammogram and also less likely to have a current Pap test. So preventative measures that really help detect cancer early, not done as regularly with women with disabilities. People with disabilities are also over 3.5 times more likely to have cardiovascular disease in the 18 to 44 age group. And it gets a little better, just under 3 times more likely when you go to the next group up, which is 45 to 64. And this is not because people with disabilities, of course, are getting more healthy. It has to do with the fact that those without disabilities are getting less healthy. So they're, quote unquote, catching up a little bit. Let's talk about some social determinants of health. And people with disabilities have double the unemployment rate among those within the workforce. And that's a key distinction among those within the workforce. I'm not talking about those folks who are unable to work because of their disability and receiving disability benefits. This is talking about people who are trying to find work and are unemployed as a result. As a result, completely unrelated to their disability. So they have double the unemployment rate among those within the workforce. And that tracks regardless of how the economy is doing. So if the economy is doing very well and you've got a 3 to 4% unemployment rate among those without disabilities, then you can pretty much assume that it's a 6 to 8% unemployment rate among those with disabilities. And then also then, of course, when the economy has problems and there's a downturn or a recession, it hits the disability population that much harder because it still tracks to about double the rate. People with disabilities are also about 35% more likely to have less than a high school education, and they're also less likely to report sufficient social and emotional support. So a lot of different things come into play when you're talking about social determinants of health and how it plays into people with disabilities' life. You can see based on these, they generally are less likely to be employed, less likely to have an education, and also less likely to have emotional support around them. Let's talk for a moment about disability across the lifespan, and I include this specific chart for a reason. And this chart shows the percentage of people with disabilities in various age groups, and this is from a 2010 survey. But it shows that the percentage of people with disabilities increases as people get older. And that's obviously not that much of a surprise, but it does suggest something that's very important that I like people that are doing work with the disability community to really understand. And that is that there are two distinct populations when we're talking about the disability community. There is the population of those people like myself who were born with a disability or they acquire their disability early in life. And then you also have people that age into a disability, which is sort of a separate population. The way people view their disabilities many times depends on which of these two populations they fall into. Someone who is born with a disability or acquires it early in life is going to have a very different attitude about their disability, is going to expect more when it comes to services and accessibility because they know what's required and they know what they should be able to have access to. Whereas a person who ages into a disability, and we see this many times with the sensory disabilities. So someone they start losing their sight or they start losing their hearing. They're not going to have the same expectations as to what the accommodation should be due to that. And they are going to chalk it up to, well, that's just what happens when you get old. And that, even though they may have that attitude, that's not the attitude we should have towards this population. We need to treat them all equally and provide them all the accommodations that they need. One thing I would point out, the article that is mentioned at the bottom of this slide, which is an article from 2015 in the American Journal of Public Health, has all the statistics I just provided, along with many more, if you're interested in reading more about this population. So let's move on to part 2, which is about disability etiquette. And I'll try to touch on some of these things. There's going to be several slides that I'm going to go through that are going to have a lot of information. I'm not necessarily going to go and read through every single bullet point on these, but I do want to highlight some of the bigger items, things that you really need to be thinking about when you're interacting with people with disabilities. So in terms of disability etiquette, let's start out talking about all types of disabilities. And the key with this is just treating anyone with a disability the way you would treat anyone else. You can introduce yourself and offer a handshake. If people have limited use of their hands, they generally will know exactly how they want to respond, and you can pick up on the cues from them as to the best way to do that. You always want to make sure you're asking before you're providing any assistance. You don't want to assume that someone needs your assistance. Many of us who have disabilities are proud of the fact that we have been able to overcome them and do things on our own, and we want to be able to do that and do not want you to assume that we need your help. That said, there's nothing wrong with asking, then just honor the person's response, whatever they say. If they say they don't need it, then do not insist. You also want to make sure that you're always talking to the individual and not their intended family member, whoever it is that is with them. If you're talking to someone that needs an ASL interpreter, make sure you still are looking at the person with the disability and talking to them. They'll pick up on those cues, and it shows a sign of respect when you're doing that. And always, the last point here I think is very important, making sure you're asking questions if you're unsure how to proceed. So always just making sure that you're asking. Most people with disabilities are more than willing to tell you exactly what it is they need in terms of support, accommodations, whatever it is. And if you ask the question, they'll tell you what to do, and then you can proceed. In terms of people with mobility disabilities, let's talk a little bit about wheelchairs and scooters. Basically, you want to treat that as an extension of the person. So you wouldn't lean on someone, you don't lean on their chair either. And another thing, as someone who uses a wheelchair, I always appreciate that if I'm in a longer conversation with someone and they are standing, that they come down more to my level, so I'm not stretching my neck to try and look up at them. And that can potentially cause problems for some people, especially if they have injuries or something like that with pain. If you come down to their level, if it's a longer conversation, that is very much appreciated. In terms of people who are blind or have low vision, always making sure that you're allowing people to know generally what's going on around them. So introducing yourself, explaining interruptions. If someone leaves the room, always making sure that they're aware of that. Because if you do a round of introductions and then someone gets up and leaves the room, that person obviously may think that that individual is still there. You also want to make sure that if you're going over something, and the ideal would be to have those materials available in a format that that person can use. But if you can't, offer to read the information to a person when you can't. And if you're asked to offer guidance so that someone can get from point A to point B, always offer your arm that they can hold on to. You never want to grab the person's arm or elbow because number one, the person's not going to be ready for it. And if you offer their arm, they can hold your arm and then follow you as you walk. For people who are deaf of hard of hearing, making sure you're getting the person's attention before you begin to communicate, especially if they read lips, you want to do that. And find out exactly what the person's preferred method of communication is for the conversation, and then following their guidance on that. You also, as you did with people who are blind or low vision, you also want to make sure you're explaining interruptions. If there's a noise or something like that, if someone knocks on a door, you always want to make sure that they are aware of what's going on and catching things that they might miss otherwise. For people with speech or language disorders, the key here is being patient and respectful. You never want to try and finish someone's sentences. That can be come across as very rude. And if the person does use assistive technology, like a speaking machine or something like that, making sure that that technology is always available to them where they can reach it. For people with intellectual disabilities, you want to keep the communication simple, using shorter sentences, completing one topic before you move on to another, and making sure that you're asking people if they have questions as you're going through the presentation, and specifically if they want to clarify. And even how you ask the question sometimes is important. For instance, you want to make sure that if there are questions that they have the opportunity to do that, and that they don't feel like they're being a burden on you for asking the question. Many times people with intellectual disabilities may feel compelled, if you say, did you understand that? They may feel compelled to say yes, even if they don't. So sometimes a better way to ask the question is, can you communicate to me how you understand what I just told you? What does that mean to you? And see if they can explain it back in their own terminology so that they know exactly how you can communicate with them. With people with mental and behavioral health issues, if the person starts to seem like they're getting anxious or agitated, you want to make sure you're speaking calmly and offering to repeat information. If they're nervous or confused, offering to restate things or breaking them down step by step to helping them understand basic terminology. And then also, in terms of how they prefer to talk about their disability, find out what it is that they prefer and go along with that request so as not to offend. All of these etiquette guidelines that I've just gone over can be found in a fact sheet on our NDNRC project website, which I'll be talking about later on in the presentation. But you can go to the link that's on this particular slide to find that. It's one of our topical fact sheets, specifically fact sheet number 17, which deals with disability etiquette. Let's talk about some accessibility challenges when planning and hosting an event. And these are obviously, there's many different things to be thinking about. You've got accessibility as it relates to how you set up the event, from all the way from the parking lot to the building to an elevator or a ramp, making sure all of that is going to work, especially for people with mobility disabilities. With the parking lot, is there enough spots for people that have accessibility needs, specifically mobility accessibility needs? And if you're hosting an event that's specifically aimed at the disability population, maybe thinking about, because many times by code, there's not going to be enough spots then if it's specifically aimed at that demographic, thinking about having some other spots that are marked off temporarily for that purpose. For building and elevator accessibility, making sure that people can get around in the building, making sure things are free of obstruction. That also goes with ramps. Especially if you're holding an event, maybe if it starts getting in the wintertime, making sure that not only stairs are cleaned off, but also ramps are cleaned off so people can get a wheelchair and there's not snow or ice in the way. For elevator accessibility, making sure that signage is clear on where they're to go to get to an elevator if they have to use that. And as it relates to both elevators and ramps, making sure signage is appropriate so people know where to go if it's not in an obvious spot. In terms of meeting room accessibility, most buildings are built to code with the ADA in mind, especially newer buildings, but they can quickly become inaccessible if you have people start putting stuff in the rooms, and they can become quickly inaccessible to people in wheelchairs. Making sure you're having areas for people in wheelchairs to be able to move around the room and set up if you're having a meeting where there's going to be a presentation, and giving options of where someone can sit, not just have space in the back where they can go. Maybe they prefer to sit closer because they also have a hard time seeing things. Having some of those areas in the front of the room marked off for people in wheelchairs is useful as a result. In terms of restroom accessibility, if you're holding an event, making sure an accessible restroom is near where that event's going to be so that people can access that. And then as we've moved so much in the last year and a half into virtual events, I've highlighted these last 3 bullet points because when we're talking about virtual events, many times these are the ones we're really talking about in terms of what we need to think about in terms of accessibility. Most people aren't doing in-person events as much as they were before. So how do we make virtual events accessible? Well, making sure we have things in alternative formats. That includes Braille, but it also includes large text for people with low vision. Or it could include having an audio version of a document or having a digital version that's readable by a screen reader. Many times, we always want people to have Braille available, but many people that have vision disabilities, they want to have something in a digital format that they can read with a screen reader. They become much more adept at using those types of technologies to read documents, and they actually would prefer that. Many times when we host events, we'll have both versions, Braille and digital. The digital always is taken over the Braille. So many times people automatically think, oh, we need to have Braille. Think more about having something digital that they can read with a screen reader. Packaging and messaging of materials. Are you including people with disabilities in your imaging? Is there a indication that people with disabilities are welcome? And making sure that that packaging and messaging is going to resonate with the community. For instance, I see many times pictures of people in wheelchairs, and I will look at it and I'll say, that person is not a wheelchair user. The way they're sitting in the wheelchair, I can tell they're not a wheelchair user. So making sure that if you have an image of someone that uses a wheelchair, that it is actually someone who needs a wheelchair, because that can actually be a turnoff to some folks to see that image and say, you know what, this is just someone trying to, show disability, but not really understand what it means. So having those sort of things, and recognizing that imaging of disability does not just mean wheelchairs. It also could mean someone that has sunglasses and a guide cane or a guide dog. It could be someone speaking with sign language or someone with a hearing aid. There are other ways to show disability besides just people in wheelchairs. And then finally, font size. When this sort of goes along with alternative formats, but when you're talking about materials, making sure that they are in the appropriate font size. So having things in normal font size of 12 point, not having too much small print stuff. But then when you are doing large print and large text versions, we're usually talking about 18 point font or higher. So having two alternative versions, one that is a traditional 12 point font, and then one that is 18 point font or higher for a large print version. And as I said, things are very different, accessibility in a virtual world. So what do we need to be thinking about that? Well, we already talked about some alternative formats for printed material, having them in digital versions. Maybe if you're out at an event and you want to hand stuff out, having them on a flash drive that is digital that you can hand them. Always allow for alternative means of participation if that's a possibility. With the way things have gone with the virtual world, there's lots of different options for ways we can do that. If you're setting things up online, making sure that images are alt texted and that there is something that the screen reader will be able to read when it comes to that image so that it knows exactly what you're looking at, especially if it's a graphic that has some important message on it. If that's not included in the alt text, then someone with a vision disability is going to miss that message. So making sure all your online images are alt texted. And how do we make Zoom accessible? Zoom has a lot of built-in features that you can use to make sure that you are doing things in an accessible way. So let's talk right away about captioning. Captioning is one of those things that's very easy to do in a virtual session. First of all, though, you've got to make sure it's turned on as an option. So I've taken a screenshot here of the Zoom accessibility features, and specifically you'll see that closed captioning needs to be checked to on. And then underneath that, there is a box that says enable live transcription service to show transcript on the side and in side panel in meeting. So that's what you need to make sure that both those things are clicked on. When you do that, then if you are the host of the event, when you actually open up your event, you will see this option at the bottom. You will see something that says live transcript with the CC box. You will click that and options come up. And this is one where if you have a captioner, which is the best way to do it, you would have the captioner log into your event early, and then you could assign them as the participant to type and do the captioning. But if you're unable to do that, you can also click enable auto transcription. If you click that, then there is an AI that's built into Zoom that will automatically do the transcription service for you and will have a live transcript going as you are proceeding through your meeting, presentation, webinar, whatever. And members who are in the session can turn that on or off and do whatever they want. They have their own settings on that so that they can, if they find it distracting, they can turn it off, they can turn it on, they can make the print bigger, whatever it is that they need. I will say this about the automated transcription service that's available. Zoom has really improved the technology, so it gets quite a bit right. There are some limitations to it, though. There are some words it still struggles with. For instance, it still can't quite get COVID right. And there are, whenever you're using terminology that's very specific, it might struggle. If you're using acronyms, they do not always come through very well. And unfortunately, also, it works well for people who generally speak English as their first language. If you have someone that has an accent or something like that, lots of times it will struggle with those as well. So the percentage that it is right goes way down when you have those types of things. So the ideal way is to have a captioner do it, and then you can click the assign a participant to type, or you can enable auto transcription if you need the AI service. So that's how you do captions. Other things you can be thinking about, using ASL interpreters and having them be able to share their video, and you can have that person can be pinned then by the person that needs that, and so that they can always see the ASL interpreter. Something else to think about when you're doing screen sharing, when you're using Zoom, is how you do screen sharing. Screen sharing is not accessible to screen readers. So if someone is blind or has a vision disability that they use a screen reader, it's not going to pick up on whatever it is you're sharing on your screen. So making sure that you're describing what you see when you're looking at it is very important. Now, chat is available, and some of the other features are available to screen readers. If you're doing polls and the like, those things can be read by a screen reader. The chat feature can be read by a screen reader. So all those things can be utilized, but making sure that if you're doing a PowerPoint presentation like I am, trying to do what I did earlier when I explained, this is a screenshot of the Zoom accessibility features or whatever it is that you see on the screen, making sure that that gets captured and people see that. Most of all, though, you want to be flexible. You want to make sure that people feel welcomed if you are recruiting them to participate in your events. You want them to feel like you've thought about their needs and what they need in terms of accommodations. So be flexible, find out what they need. If something doesn't work, be able to adapt if possible. If you make a mistake in one particular presentation and someone calls you out on it, just say, what do you need for next time? We want to make sure that we're able to meet your needs, and being flexible to be able to do that. So with that, we've reached a sort of a natural stopping point. So I'm going to see if we have any questions before we move on to talking about tips for picking a health plan.
Thanks, Karl. We don't have questions at this moment, but if you'd like to ask a question, click on the Q&A icon at the bottom of your screen and just type your question into the box. We'll pause once more at the end for a Q&A. Back to you.
Okay, thank you very much. And I know that there's a lot that I went over in terms of the accessibility stuff. So by all means, please, if there is something that you want to ask about disability etiquette, accessibility, anything like that, please ask. This is something that as an organization, we do quite a bit of in terms of technical assistance on these issues. So I'm always happy to answer. Like I said, I'm a person with a disability myself. I'm not going to get offended if you ask a question. But this is your chance. If you wanted to know exactly how to interact with this community, now's your chance to ask those questions. So please feel free to, and we can always circle back to those at the end if we need to. In terms of picking a healthcare plan, this can become very tricky for people with disabilities. So let's take a look, take a step back for a moment and just think about what the Affordable Care Act means for people with disabilities. Because there is quite a bit that was in that act that really did benefit people with disabilities. So what does it mean? Well, obviously, one of the most popular ones that we all know is it means no denial of coverage for pre-existing conditions. It means no cancellation of coverage due to serious medical conditions. It means no setting premiums based on disability or chronic conditions. And all of these things are very important when taken together, because if any one of these was missing, it could mean that people with disabilities could be denied coverage. They could be, their coverage could be canceled if they start costing too much, or the health insurance companies could price them out of the market by charging them more because they have one. So all three of these are really needed to ensure that people with disabilities can get coverage that is adequate to meet their needs. We also know that it means no lifetime monetary caps. The monetary is an important thing there. They can still cap services, but they can't cap how much money they spend on you, both lifetime and on an annual basis. There's also coverage of the 10 essential health benefits, making sure that everything that people with disabilities need is covered. This includes a wide range of things that help people that are beyond disability. It includes prescription medication, rehabilitation and habilitation supports, medical devices, mental health, a lot of different things that these populations require. It also did some Medicaid reforms, and Medicaid reforms are one of the important things that came about as a result of the ACA. It expanded a program called Money Follows the Person. It created the Balancing Incentive Program and created the Community First Choice. All of these are aimed at trying to get both older adults and people with disabilities out of institutional skilled nursing facilities and into home and community-based services so that they can receive nursing care in their home and not have to go into an institutional setting. I'll just make my quick pitch on the fact that, during COVID, we've seen just how dangerous being in an institution can be. And as a result, expanding home and community-based services has always been something that as an organization we have pushed for, because we want people to be in their home, and not just because it's better for their life, but also because it's safer, especially when things like COVID come along. Well, what are some things to be considering about when you're talking and meeting with a person with a disability about health insurance and what they need to be thinking about when they are enrolling? Well, there are some items to consider, and these include provider networks, whether the person's doctor is included. People with disabilities use doctors and have relationships, many times long-standing relationships with these doctors, especially if they're a specialist that really understands their disability. There's nothing worse as a person with a disability than having to re-explain everything to a new provider because of the fact that they don't understand all the ins and outs of your disability. And many times it's the disability can be unique to that individual in the sense of how it manifests itself. They might understand some of the diagnoses behind it, but for every individual, many times it functions differently. So nobody wants to have to go and explain that all over again. So lots of times people with a disability might be willing to pay a couple extra bucks a month in a premium if it means they're going to have access to the doctor they already see. Non-physician providers, are other providers included? This could include therapists. It could include DME suppliers, which is durable medical equipment. If someone uses a wheelchair or a respirator or anything like that, any of those types of services are done by DME suppliers, and making sure that those people that they deal with are also included in the plan. What's the pharmacy benefit design like? How are any of the drugs that the person takes, how are they treated? Is it on a specialty tier or something like that where they're going to have to pay a higher copay? Thinking about all those different types of things when you're looking at specifically how those things are designed. Is there a limitation on the number of services? We said there's no lifetime or annual monetary caps, but services are still limited or can be limited by the health insurance companies. So specifically looking at issues like whether or not physical therapy is limited, and if the person needs to continue to go to physical therapy to maintain function, then limitations can be very restrictive as it relates to what they're looking for. So the way I generally like to talk about health insurance and trying to make sure that we're getting the coverage that the person needs, as I say, it's kind of like playing a game of health insurance Jeopardy. For those of you familiar with the Jeopardy game show, in that game, it's not about the answer, it's about asking the right question. And if you're not asking the right question, you are not going to be getting the responses that you need to really be able to have someone get the coverage that they need, and they can end up in a plan that's ultimately not going to meet their needs. So let's take a look at some of this. There's a full array of these issues that I have. I am not going to go through this entire board due to time, but I do want to go over some of the highlights just to give you an idea of some of the things you need to be thinking about. All of these Jeopardy slides that I'm going to be going through are in a series of videos on our YouTube channel. And each category that you see here is its own separate video. So if you want to go through all of these, you can do that after the fact, and I'll tell you how you can do that later. So let's take a look at prescription drugs. In the instance of prescription drugs, the individual tells you that he has tried generic drugs before and they were ineffective. In this instance, you want to ask the question, does the plan require you to try a generic drug first, commonly known as step therapy? And if you have to try the generic drug first on a certain plan before you can get permission to go to the name brand drug, then that might not be the plan that this particular person wants. Let's talk about medical devices. The individual uses a motorized wheelchair and complains that her current chair won't keep a charge. Well, then the question you need to ask is, does the plan cover repair of DME? Medical devices are required to be covered under the 10 essential health benefits, but the definition of medical devices is not set in the statute. So that can change from state to state or even health insurance plan to health insurance plan. So making sure that you know what you're getting in that area and whether or not it covers repair of DME and not just replacement. Let's talk about rehab and habilitation benefits. The consumer uses rehabilitation therapy and says she has to go repeatedly for it to have any lasting effect. This is what we were talking about a moment ago. Does the plan put limitations on the number of rehab visits? Because then that can really cause a problem. Like I said, many times you'll see this with physical therapy. And if it's capped at a certain number per year, then that might not be the right plan, or find out if it's possible to get some sort of pre-authorization to extend it beyond the limitations. Staying in rehab and habilitation benefits. Let's talk about a family that has a 4-year-old child who is nonverbal. And in this instance, the question, does the plan cover speech therapies? And this is important to point out. If you'll notice, I said that this is a child that has a 4-year-old child who is nonverbal. In other words, the child never has spoken. And in that instance, we're talking about habilitation benefits. Now, if you had someone that had a stroke and had the ability to speak, had a stroke and then lost it, they might be seeing the same type of provider, which would be a speech therapist, but ultimately it would be considered rehabilitation because they are gaining back the ability to speak. Whereas with habilitation, it is a provider that is trying to teach the child something and a skill that that child never has. And many times insurance companies deal with these very differently. Many times they're very likely to pay for rehab, but they're resistant to pay for habilitation benefits. So just something else to be keeping in mind. For Medicaid eligibility, the point I always like to make with this is when you're completing the enrollment on healthcare.gov, you arrive at the questions regarding disability, and you'll come across this. The question you need to ask then is, does the individual want to apply for Medicaid? Because if you answer yes, it will put you into a Medicaid eligibility determination. And many times the person with a disability may know that they're not going to qualify for Medicaid because of their income levels or because of assets, whatever it is. And these all change from state to state. So, knowing what the rules are in your state is important. But ultimately, if the individual doesn't want to go through a Medicaid eligibility determination, maybe because they already did and they know they're going to get they're going to be determined to be ineligible, then many times you want to answer no to this question, even though they do have a disability, because it could cause a delay in getting this person coverage, especially if you're up against a deadline. Ultimately, it won't cut them out of open enrollment, because even if you're at the end of open enrollment, you can get a special enrollment period for someone that gets denied, but it just could delay the coverage. And ultimately, maybe you'd go a month then where that individual doesn't have coverage, and that's not what you want to do. Let's talk about the summary of benefits and coverage, which is the document that you look at to see exactly what is covered. The individual has a condition that requires that she takes a specific drug. The question you want to ask here is, does the summary of benefits and coverage say what drugs are covered and what the drug copays are? So understanding how all that comes into play. In mental health, I always talk about the individual that doesn't tell you about their disability, and mental health is a perfect example of this, the invisible disability. And in this instance, the question that needs to be asked is, does the individual need coverage for mental health or maybe some other invisible disability, as they may not self-report that to you? You especially see this when it comes to mental health because of the stigmas attached to mental health. So as a result, understanding exactly what the person's needs are is important. The way you can get around this is asking them. You don't want to necessarily maybe ask them if they have mental health needs, but asking them the questions about, who are the providers you see on an ongoing basis? What are the medications you're taking? And that will then suggest whether or not those things need to be taken into consideration. If you look and they say that they see a provider who is a psychologist or psychiatrist, then you can plan around that and making sure that those things are covered. Let's go to our double jeopardy round. And this deals with a lot of specific disabilities and was written by all organizations that deal with these specific disabilities. But for the purposes of this, I just want to look at the accessibility column and talk about sort of as a highlight of what I talked about earlier. So let's take a look at that and look at accessibility. This is one thing you need to think about when assisting a consumer with paralysis. And that question is, what is building accessibility? Making sure that the environment that you're meeting with them is accessible to someone in a wheelchair. The next question. This is one thing you need to think about when assisting a consumer with multiple sclerosis who has low vision. Oops. And I just bumped my space bar. Let me get back to that one. So this is one thing you need to think about where the consumer has multiple sclerosis, who has low vision. And in this instance, the question is, what is having materials that are available in alternative formats, such as large print? Our next one is, this is the one thing you need to think about when assisting a consumer with intellectual disabilities. The question you need to ask here is, what is asking questions that verify the person understands the information? We talked about this earlier, trying to get them to repeat back and explain back the concept that you told them, and not just asking them if you understand, because they may feel compelled to say yes. Next, this is the one thing you need to think about when assisting a consumer with mental illness. And then is, what is educating yourself about mental health conditions and understanding exactly what it is, getting rid of the stigmas and making the person feel safe in your specific environment. And then finally, this is the one thing you need to think about when assisting a consumer who is deaf or hard of hearing. And the question here is, what is that individual's preferred method of communication? And then respecting that person's choice and following it along, whether they want to read lips, whether they would prefer an ASL interpreter, whether they just want to write notes and pass them back and forth. Maybe they just want to meet via email and just have emails go back and forth. Any of those can be options when meeting with this population. And finally, a final Jeopardy question. We'll talk about disability etiquette as a whole. And this is the one word that sums up the best quality you can have when dealing with anyone with a disability. And I would argue anyone at all. And that is, as Aretha Franklin would say, what is RESPECT? Respect. If you respect the individual, it will go a long way. Finally, we want to talk a little bit about some resources, and I'll just take a few minutes to talk about our program, the National Disability Navigator Resource Collaborative, where you can find a lot of the things that I've gone over today. The NDNRC is an initiative of national cross-disability organizations in order to provide disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the ACA marketplaces. The NDNRC really came out of a concern of disability organizations that navigators and other enrollment specialists would not have sufficient knowledge base to assist individuals with disabilities as they made healthcare enrollment decisions. Several of these organizations began discussing ways to reach out to the navigators to provide this technical assistance and better prepare them for assisting this population of consumers. That's because it's estimated when the ACA was passed in 2010, there were 3.5 million people between the ages of 16 and 65 that were uninsured and had pre-existing conditions and/or disabilities. And these individuals still face multiple options when enrolling in their health insurance coverage, including the ACA, Medicaid in their state, possible Medicaid buy-in in their state, and possible Medicaid expansion. So it's the mission of the NDNRC to provide this support to the navigators so that they can in turn really support people with disabilities. The NDNRC is made up of 10 different national partners, including AAHD as the lead partner, but we are supported by many organizations, some of which are also cross-disability, but many of which deal with specific types of disabilities. And it's really the strong makeup of the partner organizations that have really helped us put together the resources that you'll find on the website. Let's talk briefly about the website. The website can be found at nationaldisabilitynavigator.org. This is a screenshot of the homepage that you'll see on this particular slide, and many different resources on here. If you're trying to get to the fact sheets and disability guide that I mentioned, I'll be talking about in a moment, you can go to the NDNRC materials tab that's at the top of theirs, and you'll access the disability guide, fact sheets, and the like to really provide the information that I've been going over in this presentation. Further down on the homepage, you'll see a state resource guide map where you can go ahead and click on your individual state and find different state information. This includes, state-specific resources and information on assistive technology programs for the various states and state enrollment, the information if it's a state-based marketplace, how you can access that state-based marketplace. We also have a resources and links page. This deals with a lot of different areas, including enrollment resources that are specific to a disability, mental health and behavioral health, populations with special health care needs, informations on the ACA and Marketplace and Medicare and Medicaid, enrollment resources that are sort of an overview, which includes a link if you're unfamiliar with the guide that was put out by the Georgetown University Center on Health Insurance Reforms. This is a program that was funded by the Robert Wood Johnson Foundation, also initially funded our NDNRC project, and has a lot of great resources for navigators. And if you have not checked that out, I would encourage you to check that guide out. We also have a section on enrollment statistics, as well as the ACA resources from the government and ACA resources from other organizations. I mentioned our disability guide, and this was a document that we are especially proud of. It includes a lot of different information, including it sort of acts as a disability 101. It was written by one of our partner organizations, DREDF, which is the Disability Rights Education Defense Fund. It's meant to be a disability 101 for people who are unfamiliar with disability. Goes over issues like what are the purposes of the supplemental guide, questions for navigators, who are people with disabilities and what problems have they had historically getting health insurance, how do disability rights laws affect the operation of the marketplace, how is Medicaid eligibility being determined for people with disabilities. It goes over several scenarios and talks about accommodations. One of the things I would note is this was revised since it was originally put out, but was not revised since COVID-19. We have thought about whether or not we want to update this to include more about virtual accessibility, but right now that will not be in the guide currently. But also has a section on what the navigators need to know about disability. And this includes a lot of things such as how is disability defined, what disability questions appear on the streamlined application for health insurance, why is understanding disability important, what is disability literacy, what is disability etiquette, also what is physical accessibility, and how can navigators ensure effective communication with people with disabilities. In other words, going beyond just physical, but also communication disabilities. How can navigators assist people with disabilities evaluate the adequacy of provider networks with specific plans? And how can navigators assist people with disabilities to evaluate the adequacy of the 10 essential health benefits? We also have several topical fact sheets. I'm not going to read through all these, but you'll see they deal with a bunch of different topics that are, in some instances, broader than just disability, but many times are specific to people with disabilities. You'll see the 17 fact sheets listed here. I mentioned earlier, our last one of those, our disability etiquette one, which is number 17. I would point that out as a handy tool. I would also point out 16, which is once people are enrolled, moving from coverage to care. That's the only one that's really focused on the end consumer. So that's a document that you can have and you can hand to someone with a disability if you enroll them, and it can be utilized by them so that they can get the most out of their health insurance once they are enrolled. Since it is aimed at the end consumer, it is one that is translated in English and Spanish. So you can find all those on our fact sheets page that is listed at the bottom of the sheet. The other thing you'll find there is our population-specific fact sheets. And that's what to know when assisting a consumer with a specific condition. And this is a bunch of different conditions. All of these were written by our partner organizations I mentioned earlier, if they are specific to people with disabilities. And they follow, most of these follow the same types of questions. So they ask the same question in every one. I think the only one that's a little bit different is the one for veterans, which obviously is its own unique thing. I mentioned the Health Insurance Jeopardy is on YouTube, and you can go to our channel to find all those. Like I said, all of those categories are their own separate little videos. I think they range in length from about 3 minutes up to 7 minutes. So you can watch those if you want to find out more about a specific thing with people with disabilities. We also do have outreach resources that you can use for doing outreach to people with disabilities or people in general. We're part of a project with Community Catalyst. They have an outreach hub that has a lot of great resources and includes a lot of great imaging that includes people with disabilities. If you do want to use that, we help them set up some of the photo shoots that were used. So those are people with real disabilities if you want to reach out to them and use materials that you know should be acceptable to the community. You can learn more about these in our ongoing NDNRC newsletter, which are archived at our NDNRC website at the link on this page. And I'll tell you how you can sign up for that. You can go to our site, the NDNRC website, nationaldisabilitynavigator.org, and you can sign up to receive our ongoing newsletters. They come out every Friday and deal with a lot of different things around health reform, Medicaid, and the like, especially around open enrollment. We like to highlight some of the resources that are in that outreach hub I mentioned with Community Catalyst as well. You can also go to our organization's website, AAHD.us, for more information. I mentioned our newsletters are archived, and that is there as well. And then obviously, if you want more information on broader topics, you can go to the Center on Budget and Policy Priorities, Health Reform Beyond the Basics website to get a lot of information that is helpful to help people enroll in health insurance. So with that, I think we can see if there are more questions. If you do have questions that you think of after the fact, you can certainly email, as Ina mentioned earlier, you can email the Health Reform Beyond the Basics email. If you have a specific question that is about disability, you can always feel free to email me at the email address on this slide. But at this point, I think we will open it up for questions.
Thank you so much, Karl, again. So we've gotten a few comments instead of questions, just to say how great this webinar is and how important this information that you've shared is for everyone. So thank you for that. So a few questions. The disability guide, is it available in a hard copy? And how would people receive it if it is?
I would encourage you, if you're looking for a hard copy of the disability guide, and I think we still do have some, to email me at this email address, and we can see that you get a hard copy of it.
Great. And what is the proper way to ask a person whether they are disabled in some way? The individual asking said this is particularly important for people who have an invisible disability, such as hearing loss.
Yes. In terms of, there's a couple ways to do it. Number one, whenever you're meeting with someone, a standard question that you should probably be asking is, are there any accommodations you need to make this meeting more beneficial to you or work better for you? That's one way to do it. That's a very broad way. And then when you're actually meeting with them, as I said earlier, to go over health insurance options, asking them who the providers they see are and what kind of medications they take. Are there any therapies that they need or any medical supplies that they need? And if you're getting those questions, that will give the opportunity for a person to talk about maybe some of those invisible disabilities.
We've gotten a few questions about disability determinations. So I believe that on the AAHD website, there are resources or links to resources that have more information about that. And then we have,
I would also point out just to one thing that we struggle many times as a national organization on Medicaid eligibility determinations is they do vary so much from state to state. And understanding that and making sure people are aware that, especially when it comes to disability determinations and Medicaid eligibility, that they are very much state specific.
Yeah, thank you. Very good point there. And I can actually put in the chat a link from the Kaiser Family Foundation that has a 50-state overview of the eligibility requirements for individuals with disabilities, including income limits and asset tests. And oftentimes states have asset tests for people with disabilities. So you can find that report and some data on that link, in that link there. And then we received one question from an individual. It's not quite about people with disabilities, but I can go ahead and answer it. It's the question is, many times a consumer qualifies for full Medicaid, but doesn't want it since it doesn't cover their doctors. They really want an ACA plan, but won't qualify for an APTC. Are there any appeals regarding this? So if someone is eligible for any other kind of coverage, like employer-sponsored coverage, Medicaid, Medicare, they are not able to get premium tax credits on the marketplace. But if their doctors aren't covered under their Medicaid plan, or if they have a managed care plan, or if they have just general Medicaid, there is an appeals process in Medicaid in many states that the individual can go through, but it's often up to the provider whether they're going to accept Medicaid. So the best advice that to give that person is to talk to their doctor and see if they're willing to accept Medicaid or to make an exception for them, because that does happen sometimes. Hope that answered your question. So if there aren't any other questions, we can we can wrap for the day. So thank you again so much, Karl, for this really informative presentation. And as a reminder, we'll be distributing the materials from today's session via email. We'll post everything to the Beyond the Basics website. You can view the recordings of this year's 9-part webinar series on our website. You can also find additional resources, including reference charts, guides, and frequently asked questions. And if you have questions or need assistance, if it's regarding anything to do with individuals' disabilities, please reach out to Karl. And if it's regarding anything to do with the ACA, please reach out to us at beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you again, everyone, for joining us today.